Well, we're lucky this episode to have an expert to give us some tips and treatment options for gastroesophageal reflux disease, called GERD. You may have heard of it. It isn't fun for those that suffer from it. In fact, it's estimated that up to a third of Americans suffer from gastroesophageal reflux disease, and a significant number of people aren't even aware they have the condition. Now, the two most frequent causes of GERD are heartburn and having a bitter or sour taste in the mouth. And here's the kicker. What many people don't know is that GERD also can trigger symptoms like cough, asthma, laryngitis, and even chest pain. Now, my special guest is Dr. John Pandolfino. He's the chief of Gastroenterology and Hepatology at Northwestern Medicine. Doctor, other people may not have any symptoms at all while GERD is causing damage to the esophagus. What is GERD, and how many people suffer from it?
So GERD is actually gastroesophageal reflux disease, which means that it's a disease or disorder that's associated with the movement of the contents in your stomach, whether that's liquid, digestive enzymes, acid, and food mixed together. When too much of that gets up into your esophagus and in your chest, and then maybe even your throat and lungs, that's where it actually becomes a disease. Now, many people have reflux throughout the day, but that can be kind of normal if it's not causing any symptoms. And that's really where we get to the differentiation point of whether or not reflux is something that you're just belching after a meal, or is it actually a disease where it's causing problems?
Has this anything to do at all with being overweight?
Well, we certainly know that one of the big risk factors for reflux is weight. And one of the curious things is that it actually isn't a lot of weight. When we've looked at the research, what we find is that if people have reflux and they can manage to lose 10 to 15 pounds, we see a dramatic reduction in their reflux symptoms like heartburn and regurgitation. So certainly losing weight is one of the most important lifestyle modifications we'll make in treating people with GERD.
Well, from, what I'm to understand, one size just doesn't fit all when it comes to GERD treatment. I mean, some patients only experience occasional heartburn, while others apparently lose sleep, have a nagging cough, and just generally don't feel well. Does that sort of fit the bill?
Yeah, I think GERD is a very heterogeneous disease state. It has a lot of different symptoms that can be associated with it, and it also has a range of severity that really govern how you treat people. So as you mentioned, one size doesn't fit all. I think the way to approach GERD is really in a personalized approach where you're actually using precision medicine to target the symptoms and the most appropriate treatment based on the causes of gastroesophageal reflux disease in that particular patient.
So what are, Doctor, some of the causes and what steps really need to be taken to help fight this condition? Because it doesn't sound like fun at all.
Yeah, I mean, it's a condition that unfortunately, about a third of Americans have at some particular point. And really, the thing about it is it's related to abnormal anatomy and physiology of the GI tract. So at the end of your esophagus, you have a lower esophageal sphincter, which is a muscle that actually remains closed to prevent liquid and acid and air from your stomach going up into your chest and your esophagus. In addition, there is an anatomical valve that's formed with the relationship of that sphincter and the diaphragm, your breathing muscle. And together, those two muscles work together to prevent reflux from happening. They create an anti-reflux barrier. And people can get some defects in the muscle. It could just be bad luck, getting older. And then they can also develop a hiatus hernia, which is a defect in the breathing muscle, the diaphragm. And then you actually have an opening at the end of your esophagus instead of it being closed, and you get a lot of reflux. And that reflux volume can really dictate how severe your symptoms are and what the best treatment approaches are. And we really focus the treatment based on not only how severe your symptoms are, but also how severe your anatomical and physiologic abnormalities are.
Well, I tell you what, is one of the signs, could that possibly be like if I have a friend who, when eating, tends to all of a sudden would cough up? It's like the food can't be swallowed. Is that a symptom at all?
That can be. Regurgitation is certainly a symptom of reflux, and that's when people have pretty significant issues with that anti-reflux barrier. So after they eat, that food just comes up. Maybe when they bend over, it's a little bit worse. But that can also occur with other esophageal diseases, and that's why it's important when you have that kind of symptom to see your primary care doctor, who will likely send you to a gastroenterologist for diagnostic testing.
Dr. Pandolfino, tell us about Northwestern Medicine, if you would, and how you're directly helping patients there.
So in Northwestern Medicine, really when we approach the patient with gastroesophageal reflux disease, we really personalize the approach in that, we really try to target lifestyle, symptoms. We also focus on the brain-gut interaction, which largely gets ignored by many physicians, but is very important in terms of the quality of life for our patients suffering with GERD. And then, of course, we don't ignore the fact that this is still an anatomical abnormality that we can treat with surgical procedures, endoscopic treatments. And then, of course, we can address the acid levels with medications. But in Northwestern, we try to be a little bit more holistic, but we tend to be very focused on improving people's quality of life using precision medicine.
Can you share with us perhaps some of the new treatment options that you're, discovering at the moment, working on?
Yeah, so a couple things that run the gamut. So I think one of the more important acknowledgments over the last years has been this brain-gut interaction. And I have wonderful colleagues at Northwestern like Tiffany Taft, Kate Tomasino, and Anjali Baboka, who actually work on these behavioral therapies where they can use cognitive behavioral techniques and hypnosis to actually treat reflux symptoms. And we've actually had great success in our research showing that these particular tools work. So I think that's something that a lot of people don't understand, that you can actually effectively treat symptoms of reflux with some of these behavioral modifications. And then, of course, on the other end of the spectrum, when we have these patients who have these profound anatomical abnormalities, there are these new fancy, less invasive approaches where we can actually correct the anatomy and reconfigure that anti-reflux barrier. Some of those are the endoscopic approaches like TIF, transoral incisionless fundoplication, a big word, but what it means is an endoscopic repair of your anti-reflux barrier and recreating that flap valve. And then there's the magnetic sphincter augmentation device, which is a magnetic ring that a surgeon can place around the end of your esophagus to help that lower esophageal sphincter prevent reflux. And then they can also repair that hiatal hernia during that surgical approach. So there's a lot of opportunities to treat reflux, and there's a lot of options that range from non-invasive approaches to these very invasive approaches.
Wow. I tell you what, it's good to hear the good news, though, of how you're now finding, other ways. I mean, a lot of people, if they feel they start to get GERD, I think now say, oh, look, I just better go and buy a bottle of Tums or something and keep stuffing that down your throat, and that's it. It's a lot more to it than that, isn't there? And you talk about big words. Well, gastroesophageal, I mean, that belongs with it as well. Where can people go? There's a lot to read with this. It sounds fascinating. I mean, is there a site you can go to study in your pajamas while you're having a cup of joe, maybe?
Well, I mean, certainly there are websites at the American Gastroenterology Association and the American College of Gastroenterology. We also have a webpage at www.nm.org, where if you want to actually interact with a GERD bot, we actually have a self-assessment tool that we call the GERD bot, where you can answer a few questions and it'll actually stratify your risk of reflux and point you in the direction of the right healthcare provider for your reflux. So certainly a lot of great places to get information, and even personalized information where you can actually go through an evaluation.
How about that? And that's called the GERD bot, is it?
Yes.
And it's on that site, www.nm.org/radio, or no /?
I believe no /. And once you're at the site, you just plug in GERD and you'll be taken to our webpage.
Fabulous. All right, so there you go, folks. I mean, It doesn't cost anything, and it doesn't hurt. I mean, there's an expert there, Dr. John Pandolfino. He's the chief of gastroenterology and hepatology at Northwestern Medicine. Wonderful hospital and set up in health today. They do marvelous work. Thanks, Doc. We really appreciate your time. You're a very busy man. Thank you.
Thank you very much.